Hi guys, welcome back to another video. In this video I would like to share with you how an OPD day goes in the life of a surgery intern. On our OPD day I report to the wards at 8 am when I go and check the vitals of the previously admitted patients, and if they have any dressings I will do those dressings, and then I will have to be in the OPD at exactly 9 am. Most of the days I won't be able to go to OPD at 9 am because of so many things, like I will be late for breakfast, I will be having too much of breakfast, I won't get breakfast on time. So when I get late on these OPD days I may have to face messages like these in the group and I will have to be answerable to them. So after coming to OPD at 9 am I will have to see the patients, and here I am sitting in OPD with my friend here, and we see patients. So guys, we examine the patients in OPD, and if they require some investigations like USG, there are people who come to the OPD just to get their USG done just because of a abdominal pain. It will be mostly because of acidity, because many people drink tea in the morning too much, and most of the cases will be due to acidity. They will have abdominal pain, but still they compel us to do an investigation, and we give them investigation for USG abdomen and pelvis. And there are many cases which have minor wounds and all. We send them home on an OPD basis after dressing and prescribing antibiotics. And there was an interesting case that came to OPD that day. When I was told to change the Foley's of a patient, I was not able to deflate it. Then I consulted my senior, and later he said me that the Foley's bulb was inflated with NS and not distilled water, due to which the NS got crystallized in that Foley's bulb and it was not getting deflated. Later we took him to the USG room and did a USG guided needle puncture. We usually have 1 hour gap from 1 pm to 2 pm for lunch. Then again we have to be there in OPD up to 4 pm. So after 4 pm I went to see an ICD insertion that was being done by our PG. ICD insertion is done in cases where there is hydrothorax or pneumothorax. Hydro means water, when there is accumulation of too much of water due to some reason between the chest and lungs, chest wall and lungs, it causes respiratory depression or respiratory difficulty for that patient. And when an ICD is inserted, there is the fluid comes out of the body and he is able to breathe properly. You can see here there is suturing going on for that ICD after it is inserted. It is a very helpful procedure which will help patient to relieve all that respiratory difficulty that they are getting. He has hydrothorax. You can see the water coming out of that ICD tube. So guys, in the evening we had to go to the wards because we had to give HRIG to a patient. HRIG stands for human rabies immunoglobulin. It is given to patients with category 3 dog bite. A dog bite is considered category 3 when there is extensive bleeding at the site of the wound, and there is a deep wound on the face or palms, and the dog's saliva is exposed to the broken skin. Then it is considered a category 3 dog bite. It is very severe, and along with the rabies vaccine we have to give the human rabies immunoglobulin at the site of the lesion, which will prevent its spread to brain and other vital organs, so that rabies doesn't spread to the patient. So guys, when we had come to ward to give the HRIG injection, we got a call from casualty saying that there is a patient with severe abdominal pain, and the casualty intern said that on examination he found there was tenderness in right iliac fossa and also had episodes of vomiting. We suspected it might be an appendicectomy and sent him for USG, but to our surprise, in the USG it was given that it might be an intestinal obstruction. So they seniors took it for an emergency exploratory laparotomy, and we got a chance to assist exploratory laparotomy. We could see all the organs inside the abdomen. It was such a nice learning experience for us, but at the same time it was too much of work for us also, because we had to monitor this patient every 2 hours on that day night.